Dr. Greta here with nasal congestion, something that can put your baby in the hospital, but there are a few things you can do to prevent that. So what is nasal congestion? Well, it's when the baby has so much stuff in their nose, nasal secretions, or snot if you will, and that keeps them from eating well, and sometimes that allows them to cough an awful lot. So what exactly does cause nasal congestion? Well, the nose holes are so small that the mucus can't naturally run clear down the nose and back into the throat and be swallowed. No, what happens is when it gets really thick, then it kind of gunks and clumps up and it gets stuck clear in the back. And then when those little clumps and gunks fall down the back of the throat, the baby coughs. So if you ever hear or see any little nasal secretion stuff here or kind of sneezy, snorty types of noises, you know it's not going to be very long before they're going to start coughing because those secretions are going to clump and then fall down the back. So what do you do about that? Well, nasal saline makes a big difference. How do you do nasal saline? I suggest doing it with each diaper change. And so here we have our baby. We've got him laid down. We can do the saline, and I suggest the nose drops, 1 or 2 in one side. Finish your diaper change, and then you can put another drop or 2 on the other side. Now, you do not have to suck unless you see something to suck. And what are the sucking methods? Well, one of them is the bulb syringe that you're familiar with. And some people really do like the nose Frida. And those are a good possibility. But don't suck unless you see something. And what we hope is that if you do the saline on a regular basis, you'll keep those secretions thinner so that they will continue to drain, and then you never get to that coughing stage in the first place. How often should you do this? Well, we suggest kind of doing this at least once a day with children under a year of age while they are well. And then when they start getting sick, you do it more often. If a baby really has a serious condition with the nasal congestion and it's affecting their eating and all, you can do it up to every hour while they're awake. The important thing to keep in mind is that if you start it early, it can take up to 2 days for the secretions to thin up enough to go down the back. So that's why you do it every day, and then you start increasing it whenever they start having some symptoms. The idea is to keep it from getting so bad in the first place. Now, some people like to use the spray. And the sprays are fine, but the problem with sprays in little babies is the spray just kind of goes out all over the face, whereas the drops, they go out over the face too, and incidentally, you don't just jam it in there. But there's less likely possibility for it to go out all over with the drops when they are really little. As they get older, they may enjoy doing the spray. So when should you do this? Well, or when should you call? And when is nasal congestion turned into something else? Well, the important thing is if your baby ever has a fever, you call. You don't wait around with a baby with a fever. Also, if the baby might be getting dehydrated because they're not eating, you want to be sure and call. And certainly at any other time you have any questions, call too. Well, good luck with that nasal congestion, and give that kid a hug.